So now I want to describe the MSR lumbar joint mobilization technique. If we look at the spinous process here, this is L2. I have my finger contacts in the groove just lateral to the process. The other hand, which is more inferior, is going to be on the groove in this laminar kind of region of L3. What I'm trying to achieve is with the superior hand, I am pushing medially to create a gapping of the joint, while with my inferior hand, I'm tractioning inferior and lateral, and as you'll see in the video later, I start to almost scoop with my forearm to create some flexion. So we're starting out with the joint in this position, and as we go through the motion, we're actually gapping and opening the joint and increasing some flexion mobility as well. Now that we've demonstrated on the anatomical model, we'll demonstrate on a patient. So to set up, you're just going to bring one arm and place it kind of on the side of the axilla here. I'm threading my superior arm through, and you're just going to hold down on your elbow there and just kind of clamp down. Perfect. Inferior hand here, so my superior hand is in that groove again, kind of that laminar spinal junction. I'm going to create a medial, slightly posterior tension. Taking my other finger contacts, I'm going inferior and lateral. I'm bracing with my upper body and my superior arm, and I'm creating a bit of a rotational and flexion component with my inferior hand. Now, to create more tissue tension, and I find it easier to mobilize the lower half here, is I'm going to use my forearm contact. So I'm going to stabilize with my superior hand, and I'm going to create an inferior lateral tension and a rotational, almost a flexion component here with my forearm contact. So once again, the movement I'm creating is posterior medial, going inferior lateral with a rotational, a bit of a flexion component. And you're going to work your way down throughout the lumbar spine segmentally. And then we would go and perform this on the opposite side. Doing okay there?
Oh yeah.
Yeah. So just a great way to mobilize the lumbar spine. Really effective. Another way that we mobilize the lumbar spine is in a seated position. So you've got your patient here, arms crossed. With my anterior hand, I'm going to stabilize the body and initiate movement. Posterior hand, I'm going to place nice and flat contact in that spinal laminar junction here. I should mention, you can see some bruising here. Mickey recently had some cupping. It's a great effective technique to release some of the fascial restrictions in the area, but not unusual to see bruising after that's done. So laying a flat kind of thumb contact in that groove, so to speak, we're going to slowly start to bend forward, creating flexion of the lumbar spine. Now we're going to do this a few times. Make sure you're feeling for joint movement, restriction. When you find a spot that's maybe not quite moving the way you want, you do 2 to 3 passes over that area and kind of hold those end ranges, and you can really start to feel it gap and open up, and that joint space will become much more mobile. Now, to do extension, same idea. We're guiding the patient back into extension. So we're going to do that a few times. There we go. Good. And always communicate with patients. So doing okay?
Oh yeah.
Okay, good. Now, we're going to lead into lateral flexion. So once again, I'm in that spinal laminar junction, that groove. I'm going to laterally flex towards me and reinforce that position with my contact here. So do that a few times. And actually, you can really start to feel this opening up, especially when you're holding those end ranges. You can feel that mobility increasing in the spine as you go back and forth. Good. Now, from here, we're going to rotate. So I'm just going to bring the shoulder back towards me. And at the same time, I'm reinforcing that rotation with my treatment contact. There we go. And you can really feel this one at the end range. Mm-hmm. Yeah. Good. So now that we've addressed the lumbar spine on the left side of the patient, we would go and do this on the opposite side as well.